Hey, thank you. Good afternoon. Good afternoon, everyone. And for those who are joining us from other parts of the globe, good morning, good noon, good afternoon, and good evening. Thank you for joining us today. I am Maylene Claudio. I'm the National Climate and Health Specialist for the Philippines, and I will be your coordinator for a secure webinar on advancing green procurement and health system towards sustainable pathways in Southeast Asia. Allow me to take a moment to share how we'll move through today's program and what you can expect from our speakers. Over the next 90 minutes, we will hear diverse perspectives from the United Nations system, Asian Development Bank, academia, and country government on how health systems can integrate sustainability into procurement. We will also open the floor to your questions towards the end, so please make use of the Q&A box as we go along, and we will read them during the open forum. Um, Without further ado, I think we are now ready for our program proper. And I am pleased to welcome today for an opening remarks and to formally welcome us all, Dr. Corinne Schulzig. She is the Asian Development Bank Director for Human and Social Development Sector Office. Dr. Corinne is a poverty and social protection specialist with more than 25 years of multidisciplinary human and social development experience in East and Southeast Asia and the Pacific, including 21 years with the Asian Development Bank. As the director, Dr. Karin manages a regional team of 40 staff that designs and implements impactful education, health, and social protection projects and programs across Southeast Asia with an active portfolio of $4.76 billion in loans, grants, and technical assistance, and another $1.74 billion planned for approval in 2025. This includes programs on strengthening primary health care in Indonesia, improving upper secondary education in Cambodia and the Philippines, and introducing nutrition sensitive cash transfers and strengthening social protection systems in the Lao, PDR, and Timor Leste. All projects are designed with climate and gender equity lens. In her previous role as principal social sector specialist and team leader, Dr. Karine led policy dialogue, research, project design, and implementation in the areas of adaptive and shock responsive social protection, poverty analysis and poverty targeting, the graduation approach and the economic inclusion, early childhood and basic education, technical and vocational education and training, community driven development, healthy and age friendly urban development. Dr. Karine has held long term field assignments with ADB in Cambodia between 2008 to 2013, China in 2018 up to 2022, and the Philippines at present, and with USAID in Ukraine for 2 years between 2000 and 2002. She has also had extensive country experience in Indonesia, the Lao PDR, Mongolia, Thailand, and Vietnam, among others. Dr. Karine holds a doctorate degree in development studies from London School of Economics. We welcome Dr. Karine for her opening remarks.
Thanks so much, Mylene. What a great introduction, delving way into my past. Good afternoon, everyone from Manila, and welcome to this 23rd Secure webinar. Mylene has already said that we're going to talk today about green procurement for sustainable health systems in our region here in Southeast Asia. We are bringing together policymakers, health professionals, procurement experts, researchers, and innovators to share experiences and solutions for one of the most pressing issues we have in health and climate, and that's how we buy and how we use medical products. Why does this matter? The healthcare sector contributes about 5% of global carbon emissions. When I first heard the statistic, I was actually blown away to learn that this is more than either aviation or shipping. And about 3/4 of this footprint comes from supply chains for medicines and devices, including production, packaging, transport, and disposal. Without action, the World Economic Forum warns that this footprint could triple by 2050. Here in Southeast Asia and elsewhere, health systems are under pressure, not only from climate change itself, but also from unsustainable energy use, medical waste, and procurement practices. What does green procurement offer us? Well, as you might expect, green procurement means purchasing goods and services that have minimal environmental impact. It can lower emissions, reduce waste, protect patients and health workers, and even bring down costs over time. We already have technologies for things like reduced packaging, more durable products, and digital solutions, but there are still a lot of challenges like higher upfront costs, limited suppliers, lack of policy coherence and standards, limited private sector engagement, and general cultural resistance. A lot of our large-scale health investments here at ADB are already being designed to include green procurement activities. For example, in the Philippines, the proposed Access UHC project is going to procure air conditioners with variable refrigerant flow and solar panels for hospitals, both of which are going to significantly reduce energy bills and carbon emissions. These are going to be procured with support of the Japan Fund for the Joint Crediting Mechanism. This is a fund that aims to provide financial incentives for adopting advanced low-carbon technologies in ADB public and private sector projects. And let me just say that Access UHC stands for Accelerating Expansion and Sustainability of Health Services for Universal Healthcare. In Thailand, our upcoming Climate Smart Health Services System Enhancement Project will also include energy-saving equipment and other climate-related activities through the Japan Fund for Prosperous and Resilient Asia and the Pacific. So our goals today are to share global, regional, and country experiences in advancing green procurement, to raise awareness among policymakers and professionals, and to explore strategies, technologies, and investment opportunities for scaling up. Over the next 90 minutes, Mylene already mentioned, you'll hear perspectives from the UN, ADB, academia, and government, followed by reflections on policy implications and investment opportunities. Together, we'll discuss how Southeast Asian health systems can adopt sustainable procurement pathways that strengthen both health security and climate resilience for a win-win. With that, let me thank you all for joining and turn the floor back over to our moderator, Miss Mylene. Thanks so much, Mylene.
Thank you, Dr. Kareem, for your inspiring opening and for providing us with a compelling framing of why this discussion or today's discussion matters. And I think now we are ready for our session presentations. Our first speaker will present the UN perspective on green procurement. Mr. Senthil Kumar Subramani is a highly accomplished procurement senior manager at the United Nations Office for Project Services, or UNOPS, where he currently leads procurement operation for the East Asia and Pacific and multi-country office. With over 17 years of dedicated service to UNOPS, Senthil has gained extensive experience managing diverse projects and programs across 10 different countries on 4 continents. This global exposure has equipped him with deep understanding of complex supply chain dynamics and cultural operational environment. Over to you, Mr. Senthil.
Is that okay now?
Yes.
Okay.
Yes. Yes.
Figured
That's
it out.
Yes.
Sorry for that. Okay. Am I audible as well?
This is great. Thank you.
Oh, perfect. Okay, I did speak without displaying it, so I'll just rerun it again, just to show you the journey of sustainability within UNOPS, where we started in 2008 and where we are in 2025 right now. It's a learning and development journey, trial and error methodology as well. There are some initiatives which I'll go through in the next couple of minutes, and I'll go through how we implement it as well. To set the stone, UNOPS within the UN family is one of the leaders in sustainable procurement implementation. On the right side of the screen, you could see the World Procurement Awards for supplier diversity within the UN Procurement Awards as well. We've been continuously winning awards. And on the bottom of the screen, you also could see the CIPS, which is a Chartered Institute of Procurement and Supply, or Purchasing and Supply rather, where we got gold certifications for continuously 3 years in a row, or rather 4 years, including this year, for sustainable procurement review. How do we implement sustainability? We do have 3 different pillars. Number 1 is the implementation guideline for the procurement professionals within the organization. Number two is the mandatory requirements, like Ms. Kareen was mentioning, mandatory requirements within the ADB projects and programs. Similarly, we do also have certain requirements depending on the type of the solicitation, depending on type of the goods or services that we buy. And we also have a certain category within the mandatory requirements where you should not be procuring products that does not have certain standards. And we'll not go into that detail, but the more important ones is the programs and initiatives. How do we make sure the market is ready? How do we contribute and develop the capacity of the market to ensure that they provide us green products, inclusive of disability personnel and gender responsive procurement as well. So that's the 4 initiatives which we will go in detail. So without further ado as well, why do we do it? Like any public procurement entity, the first 4 principles are more or less the same. There could be little changes here and there with ethics, professionalism. But the last pillar is the sustainability pillar, which has been core in our values, how we implement projects and alignment with the SDGs as well. What do we put into the criteria? We do have a framework, as I said in the couple of slides before. These are the 8 pillars we kind of try to cover, not just the environmental side of it. There's social and economical side of it as well. And we make sure it goes into every single procurement of a value more than $10,000. So it's a mandatory requirement that you incorporate at least 1 or more, depending on what the requirement is, whether it's a goods, services, or a works contract. Just to give you numbers on how the health procurement within UNOPS and what the number of criteria that were included in the last 5 years. If you remember the journey that I showed you right on the second slide, we've been capturing all the data for the last 5 or 6 years now, and that's exactly helping us to take effective decisions where the implementation can have what type of categories of procurement, what type of requirements can have an environmental or a social or an economical criteria, and it's captured by every single aspect or subcategory of these 3 main criteria within the sustainability as well. The initiative that I was talking about are 4 initiatives which we work exclusively with the supplier community. Number 1 is the supplier sustainability. We call it DRIVE. What is DRIVE? DRIVE is delivering responsibility in vendor engagement. That's what DRIVE is all about. This is an initiative that actually helps the suppliers to build their capacity, how to leverage sustainability in their entire supply chain. It is a data-driven approach, and I'll show you in the next slide how we operate it as well. And this slide is basically to show you the different aspects of the initiative. This is exactly same of the ILO principles and the 10 different categories within the ILO principles as well. So we monitor every single of those aspects through the implementation, which is shown right now. Yes. So it's first step. What we do is every single bidder who submit a bid to the response of any tenders that UNOPS publishes, they fill in a self-assessment form in our e-sourcing system, which is the e-procurement system. We have a pool of personnel sitting in different countries, do this inspection of the assessment that is submitted by the suppliers, either through physical inspection or through desk verification. Once that is done, we help the supplier through a dashboard that is shared with the suppliers to develop a capacity action plan if we see there is a gap of improvement to be done, whether they are at a mature level or a basic level or below basic levels. And then we come up with the measurement and report impact together on a regular basis. This is the cycle that happens, and that is basically how the implementation is going on. Just to show you where this is happening, this is only the physical inspections, not the desk verifications. We also have developed an app that is actually reflecting what we're showing the in the previous slide, which is called the Drive Risk app, which we recently piloted with verifications for suppliers in Kenya. If you are especially looking for health sector verifications, you could actually see Mexico on the left side of the screen, which is the site inspection capacity development for medicine and medical suppliers in Mexico, and a few other projects in Honduras and Nicaragua as well. If you're looking at this side of the world, we did quite a lot of inspections in China for medical equipments and medical supplies as well. The next initiative is on the supplier development and diversity. This is called UNOPS Possibility. Within this initiative, we have three pillars: UNOPS Possibility, the forum, which is the vendor forum, we call it Possibilities Forum. We also have a supplier resource center, and then we also have an online possibility portal. We'll talk about each one of them in the next following slides. Resource, I haven't put that slide. Basically, it's where it shows how to do business with us. There's an e-learning course which is free of cost. Any supplier who is interested in doing business with us can do that and identify where to identify business opportunities, how to do business with UNOPS, what are the type of top categories that we're procuring, and all those details are there. But on the Up Forum or the Possibilities Forum, I've just put in one picture from the recent one last year, which we did with 10 other UN entities in the southern Philippines, in the city of Cotabato, where we had, I think, more than 400 plus participants were there. The idea of such forums, along with the other UN entities, is to build the capacity, strengthen the local markets, make sure there are network opportunities between those supplier communities as well, expand the supplier base, that's the key thing as well, and increase the diversity of the supplier base, and which is also going to be the following next slides, which results in the principle of effective competition, value for money, all those public procurement principles. This is some of the pictures of some of the worldwide Up forums we have done for the last 8 or 9 years now. 2,145 plus participants across the 3 different continents. Whoever has participated, we also track that, how many bidders have participated, how many have submitted bids, and how many have managed to win contracts with UNOPS, and that's the diversity that the numbers talk about as well. Along with the possibilities portal, we also have the gender responsive and the disability responsive procurement as well. In terms of gender responsive procurement, we make sure any procurement, service, goods, or works, gender equality and women empowerment is included in the requirement by default, specifically if the value is more than $250,000 and above. Disability inclusion is it's participation of the person with the disabilities. For example, even management services, construction services, where you build a lot of health centers and stuff, where disability inclusion is a key component of the project design in itself. And that's something which is a mandatory requirement within the entire UNOPS. This was not an initiative that we were doing previously, but this is something which has been for a kind of a requirement and a mandatory initiative that has come through in the last couple of years, which is on the climate action. Based on the COP28 commitments, UNOPS is working on these targets, which you can see in the slides, which is 45% reduction of emission by our operations by 2030, net zero by 2050, and then the climate resilience and emission from our entire supply chain as well. How do you do it? That's the next question probably you should be asking. Is the mitigation measures both through carbon emission reduction within internal and external procurement? When you say internal, that is required for our internal operations and for the clients or the beneficiaries of the donors who we work with. Climate risk management in the entire supply chain, capacity development for all the stakeholders who are involved in the entire projects we implement. And how do we plan to achieve these targets? The 45% is a 2016 baseline. First and foremost, by in the next couple of years, 100% of the identified categories, which includes pharmaceuticals as well, will have climate considerations in it, number one. Number two, 100% of all the strategic suppliers will be requested or currently being requested, let me put it that way, to have a emission reduction plan and regularly report their emissions as well. The last part is the global long-term agreements, which is a framework agreement that is valid for a period of 3 years, 5 years, depending on the requirements, must have climate considerations. And based on the benchline from the benchmark from the first year, we try to look at the second, third year, and fourth year, and fifth year, what the improvements are. And there are certain level of SLAs agreed and put into the contracts. Just to finish up and round up the entire presentation, I'm going to show you a couple of projects, which includes, sustainability. As I said, mandatory to have sustainable requirements in almost all the procurement of value more than $10,000. But this is just to show you more where it's having an impact and how do we make sure the requirements are incorporated with either environmental, social, or economically factors of sustainability. This is a project with the World Bank, Department of Health. You could actually see that on the right side you have the impact, and the left side you have the sustainability highlights as well. Without going into details, I think I'm almost running out of time. So the next one is also from the Philippines. Obviously, this is from the Asian Development Bank, where more than 1.7 million PPAs, CT scanners, waste treatment facilities was also developed, a more than $60 million project. Some of the other projects across UNOPS, $2 billion worth of medical and medicine supplies for the government of Mexico, ambulances for the government of Ecuador, for the Ministry of Public Health, 188 ambulances, saving of 4.5, where we could buy 30 more ambulances, which means every year 50,000 plus patients being served. This is Haiti. You could ask what's the relation between the solar power and the this particular webinar. This is more on the green energy. That's number one, and it's for hospitals. As I said, almost all the construction projects, what we do to incorporate wherever possible green energy, wherever possible disability, inclusive gender equality, women empowerment, and traditionally as well, there's another category which we concentrate, which is like traditionally disadvantaged groups within the community. We're also kind of empowered, and skill sets are being transferred to them through capacity development as well. And this is the last slide where you could actually take a look at some of our reports and publications if you are interested to know how sustainability is being implemented within UNOPS and what are the contributions we make to the other UN entities or the humanitarian world as well. So thank you so much. And that's my end of the presentation.
Thank you, Mr. Subramani, for outlining the global frameworks. This could definitely guide Southeast Asia's efforts. Our next presentation, we will hear ADB's best practices on sustainable procurement and health system. And I'm pleased to introduce Mr. Philip E. Kalpaxis, who's the Principal Procurement Specialist of Asian Development Bank. He leads a procurement team supporting the processing and implementation of sovereign projects and programs in the human and social development sector. Before joining ADB in 2022, he worked for over a decade at UNICEF, most recently as acting chief for market influencing and supplier financing, leading global and local market shaping strategies to improve access, affordability, and sustainability of essential products and services for children. He previously managed global procurement and supply of HPV vaccines and supported new vaccine introductions in the middle-income countries. Earlier in his career, Philip spent nearly 7 years with UN Office for the Coordination of Humanitarian Affairs, holding various roles at both headquarters and field levels. Over to you, Mr. Philip Kalpaxis.
Thank you, Mylene. Can you just confirm that you can see my slides in full screen mode?
Yes.
Thank you. Thank you very much. Okay, so good afternoon, everyone. It's great to be here and to talk about a topic that is actually very close to ADB's heart. As you know, at ADB, we work a lot on sustainability through policy dialogue, through financing, climate action, but procurement is often kind of the quiet powerhouse, if you will, for change. Globally, procurement adds up to $13 trillion annually, and it's linked to some 15% of global greenhouse gas emissions. And for ADB alone, procurement makes up more than $9 billion each year. So the way we choose what to buy and who to buy from can have a truly transformative impact. Of course, procurement must deliver value for money, but value for us goes beyond price. Every time we specify a climate-friendly product, every time we factor in carbon footprint or consider social inclusion in our procurement decisions, we are, in fact, shaping markets and we are driving sustainability. And this is especially urgent in our region, in Asia and the Pacific. Our region is home to 60% of the world's population, and it produces almost half of global emissions. At the same time, it's also one of the most climate vulnerable regions. Extreme weather already costs our developing member countries billions, and unchecked, there are some estimates that say that climate change could cut regional GDP by 17% by 2070. All the while, the region is also in need for about $1.7 trillion a year in infrastructure investments. So with those amounts, it's essential that this growth is also aligned with low carbon, resilient pathways, and procurement is for us a practical tool to make exactly that happen. So so in broad terms for ADB, green procurement is a cornerstone of linking development and climate goals, because it does help countries reduce risk, it does help countries accelerate uptake of better technologies, improve their competitiveness, and also ensures that communities benefit more deeply from every dollar that is spent. So how does ADB actually work towards making procurement more sustainable? First, we need to remember what we are at our core. We are a financing institution. We provide money. We provide money in different forms, in loans, grants, guarantees, or technical assistance. And increasingly, we're using those resources to support climate mitigation and climate adaptation and sustainable procurement strategies. So in practice, that means embedding sustainability considerations into every project we finance. So when governments borrow from ADB, sustainability is built into the design, it's built into procurement processes and also ultimately into contract management. And in this way, ADB finance projects become, if you will, living examples of how green procurement can work, hopefully, showing that it's feasible, showing it's beneficial, and again, hopefully inspiring others to also follow suit. But it's not only about the money. We also provide technical expertise and knowledge sharing. Our teams guide governments on best practices. We run training programs. We create opportunities for peer-to-peer learning. And all of this is intended to empower our DMCs to craft green procurement policies and strategies that are suited to their particular context. And I'll talk about this a bit more in a second. Collaboration is another key piece. We don't do this alone. We do work with other MDBs, think tanks and NGOs and international organizations. And by coordinating our efforts and sharing what works and learning from each other, we hope to amplify our collective impact and help to set also global benchmarks for sustainable procurement. Policy reform, just as important. ADB helps countries build regulatory frameworks, institutions, and government systems that all enable sustainable procurement. So what we do is we help align policies with international standards, but again, adapting those to the local realities. And then there's market shaping, and whereby signaling demand for greener products, be it low carbon cement or green steel or shorter, lower emission supply chains, we can send a strong signal to markets about the future, and typically suppliers respond to these to stay competitive. So procurement isn't just about buying what already exists in the market, it's really about nudging the entire marketplace towards sustainability. So let me give you a quick overview of what ADB has done so far and where we're heading. Our history is not quite as vast as that of UNOPS in this space, but back in 2021 and 2022, we developed ADB's guidance node on sustainable procurement, which sets out the principles for applying sustainability across our operations. We also updated our standard bidding documents so that now sustainability is built into tendering and evaluation. And we also trained our staff with tools to help put these changes into practice. By 2023 and 2024, together with some of the other MDBs, most of other MDBs, we issued a joint statement on sustainable procurement. Again, signaling that this isn't just ADB's agenda, it's a shared agenda. At the project level, we piloted sustainability criteria and carbon measurement, and we also undertook some initial market research on green construction materials. On the countryside, we completed diagnostics of national procurement systems to give us a clear picture of where DMCs stand and how sustainability can be integrated. And to consolidate all this knowledge, we created the Sustainable Procurement Resource Hub, which has become a go-to platform both for ADB staff as well as for our DMCs. And so now in 2025, our focus is really on scaling up through 5 priorities. First, we're measuring carbon emissions in ADB finance construction projects more systematically in order to pinpoint where procurement can actually reduce footprints more effectively. The second one is that we are conducting a market maturity assessment of heavy construction materials like steel and cement, and also engaging industry more deeply, as these are among the biggest contributors to emissions. Third, we are helping DMCs embed sustainability in their procurement system. So it's not just about ADB's projects, it's about institutional change, really. And we're also strengthening monitoring and evaluation and reporting to better track progress and impact. And we're promoting continuously digital procurement systems to make green choices easier to implement and also easier to monitor. One thing that we've learned is that different regions or different sub-regions have different drivers and priorities when it comes to green procurement. So our approach to sustainable procurement has to be differentiated as well. If you take Southeast Asia, for example, we have a manufacturing powerhouse with large market demand and higher emissions. So here the push often comes from those countries wanting to stay competitive in export markets and meet international standards. And there's also a real potential for regional harmonization of standards. If you compare that to the Pacific, on the other hand, then you have smaller countries which are also smaller emitters, have smaller markets and very few local manufacturers. So for them, the focus is more on resilience and durability. So using local bio-based materials like bamboo where feasible, or ensuring that facilities can withstand climate shocks, designing for easier operation and maintenance in remote settings, and so on. So while the contexts differ, the principle is the same. We need a tailored approach that reflects local realities, but it still pushes us towards greener and more resilient procurement systems. So if procurement is to drive change, sustainability must be built into the entire cycle that you see here. So at the pre-tender stage, it starts with asking the right question. So what do we really need? Can we achieve it with fewer resources, perhaps? Sometimes that means prioritizing digital solutions over new infrastructure, or choosing energy efficient equipment that lowers the cost and emissions in the long run. It can also mean leasing or renting instead of buying outright in order to reduce waste and extend asset life, and also align incentives for maintenance. And in this phase, early market dialogue is also key, which is why we encourage our DMCs to engage suppliers upfront and signal this demand for greener solutions. During the tender stage, the next stage, we move from buying less to buying better. So our bidding documents already embed sustainability requirements. One of ADB's most important reforms will begin next year on the 1st of January, where all internationally advertised contracts financed by ADB will require mandatory merit point criteria. And this change basically means that technical evaluation, which covering quality and covering experience and innovation, local participation, but most importantly also environmental considerations, these will carry at least 50% of the weight in high-risk procurements. So from 2026 onwards, contracts will not be won by being the cheapest, but by demonstrating the capacity to deliver sustainable and high-impact results. And finally, at the post-tender stage, we do support our DMC governments to ensure sustainability clauses that have been included are actually enforced. And that may include reporting on energy use and wastage. It may include maintaining equipment to extend its life, and recycling or safely retiring the assets at the end of use. So coming to specifically the health sector. So implementing sustainable procurement in the health sector brings both unique opportunities and challenges. So unlike some of the other sectors, health is, as you all know, it's highly technical, it's highly regulated, and also sensitive, because every procurement decision directly impacts patient safety, and it also directly impacts public trust. And this makes the case for greener procurement both compelling, but it also makes it significantly more complex. And just as we adapt approaches across different DMCs that I just showed, we must also respond to the specificities of the health sector. So health systems procure almost everything: medicines, devices, energy, food, cleaning supplies, waste services, you name it. And this breadth offers several entry points for green procurement, which is certainly an opportunity. Hospitals can procure renewable energy, efficient HVAC systems, they can adopt recyclable devices and contract waste management services that avoid incineration. We've seen some hospitals piloting reusable gowns, sterilizable kits, and more broadly, biodegradable packaging. That's also we also see a lot of that. And as about 70% of the health sector's carbon emission actually come from the supply chains, these kind of choices, they can have an enormous impact. Karen mentioned it in her opening remarks. She also mentioned that the health sector faces certain constraints that other sectors perhaps do not, right? Patient safety, for example, and treatment efficacy, they are just non-negotiable. If in energy or transport or other sectors, some of these green options, like a solar panel, like an electric bus, they can be clearly evaluated on cost, and they can be clearly evaluated on performance. In health, it's a bit harder to define what is actually a green alternative. How does a green alternative look like? Another obstacle, if you will, is the lack of standardized sustainability criteria. If you look at buildings, you have some certain LEED standards, or in appliances, you have energy labels. In healthcare, there's no global eco label, let's say, for syringes or for IV fluids. So procurement officers, they often lack benchmarks, and they must develop specifications from scratch, which demands both technical knowledge, but it also demands the confidence to defend those criteria later. There are some, beyond these product-specific challenges, there are systemic barriers, but we don't have really the time to go into these. But again, Karen mentioned cultural resistance sometimes, also perhaps the lack of availability of green suppliers in our region. The fragmented nature of the health sector is certainly not making it easier, and the role of regulators in either accelerating or even hindering the adoption of greener alternatives. So all of this is specific to the health sector and needs to be considered in our approaches. But you know, we need to look at both sides, both at civil works, which generally are a bit easier to address because a building is a building and sustainable design practices are well established. For goods, it's a bit more complex, as I just mentioned, because there is a trade-off, or you cannot have a trade-off between greening and patient safety, or greening and treatment efficacy, supply reliability, and so on. Nevertheless, both matter. You know, you don't want to have a green hospital stocked with single-use plastic and powered by a dirty grid, because then you've won only half the battle. So, the positive thing is that we do see that ministries of health in Asia and the Pacific, they are beginning to champion procurement as a lever for sustainability, and we'll hear more about it from in this webinar. And we do acknowledge that the journey is complex, but from our perspective, the direction is clear. Procurement must evolve from narrow focus on cost and supply to actually capturing the full picture of value. And on our side, we'll continue supporting DMCs to find these tailored solutions that can help them to sequence reforms to match each country's capacity, and also to encourage learning across sectors and across borders in order to help make green procurement in our region both achievable and also impactful. I think that's all the time I have. So thank you very much, and I'll hand over back to Mylene.
Thank you very much, Philippe, for sharing a comprehensive list of sustainability practices and procurement and how this can be embedded into operation and investments. At this juncture, we are now down to two more presentations. So we encourage everyone to please use the chat box for your questions, which we can later on discuss during the open forum. And now for a look at innovation, we turn to Dr. Nick Watts. He is the Associate Professor from the National University of Singapore, who will discuss on technologies and digital solutions for greener procurement of medicines and devices. Professor Watts is the Director of the Center for Sustainable Medicine, leading NUS efforts to accelerate transition to net zero and resilient healthcare systems across the world. Prior to the NUS, he worked as the Chief Sustainability Officer for the NHS, where he spearheaded the national health system efforts to deliver low-carbon healthcare across the country. Without further ado, Dr. Watts, the floor is yours.
Hi, friends. You can hear me okay?
Yes, and we can
Very
also
good.
see your
You have a
presentation.
holding slide up, which just has a QR code that that takes you to a website. So if you want, I don't have any slides other than that. You could take that down, and then we can see each other a little bit. But entirely up to you guys. Listen, thank you so much for having me here. It's really good fun to be here, and it's really cool, frankly, to hear all of the work that is happening in the ADB, happening with UNOPS. It's worth reflecting on the fact that 5 seconds ago, that would honestly not have been the kind of thing that we would have been able to say. We didn't have that kind of visibility over the emissions profile of supply chains. We've done a lot of work there, and we've got a lot better. Nonetheless, every time you talk about Scope 3 emissions or supply chain emissions or procurement emissions within a healthcare system, people say a bunch of, I kind of think quite annoying, sometimes kind of rubbish things. They say, oh yes, Scope 3 supply chain, very complex, very difficult to estimate, very difficult to count, very difficult to act on. No one can really do much about it. It's a big problem. And then they stop. And I'll be honest with you, it might just be that it's Thursday and I'm a bit tired. I'm kind of sick of that response, hey? Nonsense, you can't count it. Nonsense, you can't act on it. It is entirely within the power of a healthcare system or an individual clinician or a MDB like the ADB to act on. Let's break it down a little bit, hey? So firstly, sometimes you hear people say we should only focus on our direct emissions, scope 1 and scope 2. Now, the reason they're saying that is because of some clever accounting mechanisms from 2 or 3 decades ago. And I get it. It's an attempt to avoid double counting, and it works at the national level only, but it doesn't function at the healthcare system level. The most obvious reason for that is we have just finished with the ADB working on carbon footprints across the region in the Philippines, in Fiji, and then ourselves in Singapore. They're not public yet, but if I give you some round numbers just to estimate, about 90%, between 80 to 90% of the emissions from each of those healthcare systems are in our supply chains and our scope 3. You couldn't, hand on heart, say, I'm going to run at this, I'm going to really have a good go at it, but I'm only going to tackle 10 to 20%. It would just be disingenuous. The reason for that is pretty obvious. Healthcare is basically one giant, in the world of a carbon accountant, is basically just one giant consumer. We are like a huge household. We consume a lot of stuff. We consume everything from the drugs, the scalpels, the gloves, yes, of course, pages and fax machines and MRI machines, and we do it in very, very, very high quantities. So it shouldn't surprise us that that's where our supply chain and our procurement emissions are. But if we stop for 1 second and stop using scopes like the GHG protocol and stop talking about this as only a procurement or a supply chain challenge and think about it from the perspective of a clinician, well, God, it is our asthma nurses who decide which medications they're going to send our respiratory patients home on. And when they decide to engage in a bit of patient education and increase the rate of ICS and decrease the rate of overprescription of SABA, that is a scope 3. It's a supply chain emissions reduction. When we have a good GP who is out in community thinking seriously about polypharmacy and reducing unnecessary overprescribing, that again is a scope 3 emissions reduction. And our physiotherapists in an orthopedics ward, when they're thinking about mobility aid reprocessing programs or digital care out in community care closer to home, those are all scope 3 emissions reductions. The point I'm trying to get at is that we have agency over these, and we, yes, absolutely have the supply side levers that we get to pull on, the big procurement levers. But I want to encourage us to always think about the clinical levers as well, the healthcare system levers, because from the perspective of a healthcare system, of a clinician or a patient, that's what we are, right? We're delivering care. The human side are what we're talking about. But taking a step back and broadly looking at the solution space, it's a little tricky, and people get tripped up sometimes thinking about the solution space for procurement. And that's kind of because, well, we're talking about so many different things that we've already heard from the 2 speakers before. The things you would want to do to tackle emissions for an MRI machine compared to a psychotropic, compared to a drug, they are just so different. So let's walk through a couple of the categories of intervention available to us. Number 1, efficient consumption of stuff. Do we really need it? Do we really need it? My brother he's just come out of surgery yesterday. He had his appendix taken out. He's totally fine. He got discharged 3 days later, which he was totally fine the whole time. I'm not sure he needed to be there for that long, but in the extra time that he was there, he had 4 CRPs, a blood test measuring inflammation, per day. I'm not quite sure what was going on there. He had a whole bunch of blood tests taken. He took up a huge amount of resource. And frankly, I think he probably should have been discharged on day 0. Now, this is me being a little bit mean to my little brother, but there's a real question there around, can we deliver better care for our patients? Can we deliver higher value care, lower cost care for our patients? The answer, I bet you, is almost always yes. Once you've decided that you really need the thing, well, then you have a question around the manufacturing of it. And exactly where the carbon is for that depends on what we're talking about. So if we are talking about the manufacturing of a relatively simple but heavy single-use piece of metal, so I'm talking about a scalpel or some forceps, then for the most part, the primary determinant of the carbon attached to that will be the grid from the country it's in. If we are talking about pharmaceuticals, interestingly, the grid becomes slightly less important, and what matters is the kind of pharmaceutical we're talking about. If it is a small drug, I'm talking something like below maybe 5, 10 kilodaltons, for the most part, it's either some of the local manufacturing processes or it's actually just the transport and the packaging, because it's quite a small, quite an easy to produce drug, and so other things predominate. If it's a bigger drug, over 10, 20 kilodaltons, up to those, 50, 100, the big recombinants, well, then other questions matter. Does it have a chiral center? Does it have any heteroatom diversity? And within each of those sorts of questions, you then go, okay, great. Well, if it does have one of those big, complex chiral centers, there are actually now a couple of green bits of chemistry that we can start to introduce into the manufacturing process that make it that keep the same active pharmaceutical ingredient, but make things quite a fair bit more carbon efficient. You get into, once you've moved from the manufacturing, you get into the transport and the packaging question. And there, listen, for the most part, we were just talking about it. For those low carbon drugs, packaging and transport predominate. And so if you are interested in low carbon vaccine programs, if you're interested in low carbon cold chains, regional hubs, regional production hubs are one of the most carbon efficient things that we could be doing as a healthcare system. You move from transport into the actual use of things. Now, sometimes we have a drug that we consume and the use phase is gone. There were no emissions attached to that. Sometimes we can act on the thing within its use phase, and this is either something like an MRI, right? And the emissions for an MRI machine, the use phase is what dominates. By far, the most effective thing you can do is to not buy another MRI the second one comes out. To update the software, to hold it on for just another 50% of its half-life, I promise you the clinical outcomes will be almost exactly the same. Sorry, not almost exactly the same, will be exactly the same. The carbon will be a lot lower and the cost will be a lot lower too. You then get into the world of reprocessing. Fine, if we do need to buy another thing, well, can we engage in a little bit of circularity? We've been studying this really quite closely at the Center for Sustainable Medicine. We looked at 6,400 different scenarios out across the region, and we asked a pretty basic question. What are the primary determinants of a mesocomplex surgical device being more carbon efficient if it is reprocessed, right? Is it about the weight? Is it about the kind of product it is? Is it about how many uses it goes through? For the most part, two things matter. Use phase matters, so the number of times you are reprocessing that device, and the more expensive the device gets, interestingly, for the most part, that's an indication of complexity. It means that you don't need that many uses for it to become worthwhile. In fact, we found for the most part, it was half of what the manufacturer recommended was the limit for that particular device. The other thing that obviously matters, and it matters a lot, is the carbon intensity of the grid you are operating within. We found that once we moved beyond about 600 grams per kilowatt hour, 650 grams per kilowatt hour, we were able to prove that almost every device we were looking at was lower cost and lower carbon if it was reprocessed. To give people a little bit of a sense of context of what 650 looks like, Australia, which is a particularly dirty grid, a particularly high carbon grid, that's at about 670 grams per kilowatt hour. China, it's about 570. Vietnam, 620. The Philippines, 620. It's good news because it means that in each of those countries, once you pass that threshold, this is almost always going to be a worthwhile intervention. You do all of that. You do that demand side, clinically led sort of set of emissions reductions, focusing on high value care and primary care. You make sure you walk through that hierarchy, the efficient consumption of stuff, the efficient sort of manufacturing of it, its transport, its use phase, its reprocessing. Eventually, it's disposal and recycling. Honestly, I've spent the day wandering around hospitals looking at different recycling programs. I'm so unconvinced by quite a lot of that. And so I would probably personally advise we look elsewhere for our emissions reductions. But then you come on to what we were just hearing about from our friends at UNOPS and the ADB, the procurement level interventions as well. There's absolutely things we can do to build circularity into our contracts. I've been involved in doing some of that at a healthcare system level in the United Kingdom and in Singapore. Pretty simple, hey? Set a long-term target. Within the decade, this healthcare system will no longer procure from anyone that does not meet or exceed our commitments on sustainability and net zero. And then slowly walk through. As a gateway, a condition of entry into a procurement agreement, we just want to know what your emissions are, just scope 1, just scope 2 for big contracts, nothing that onerous. Slowly expanding that out, initially contracts over $5 million and then smaller and smaller contracts, always leaving space for SMEs, for small and medium-sized enterprises. The introduction of a 10%, a 20% weighting into tenders. Listen, the purpose of that is honestly not to change procurement. The purpose of that is to start to build us up, build up the carbon literacy of our organizations and of the industry so that we have had those conversations, so that we are ready for the harder things that come. You then start to ask for product level footprints. The specific footprint of this scalpel or of this MRI machine as I purchase it, not of everything, just of new things. Let's start slowly. Let's be reasonable as we go. You combine those 3 strategies together all around the region now. We are starting to see some pretty cool things out there. What I want to end on is that when you look at all of those different interventions and all the different policy levers that we have available to us, none of them are particularly high tech. And it's worth thinking about that. It's worth thinking about the fact that for the most part, we are talking about some pretty common sense things in medicine. For the most part, we are talking about some pretty common sense efficiency measures within healthcare. I'd encourage us to stay focused on that, to stay focused on the stuff that we already have data on, and to never, ever, ever say, oh, yeah, scope 3, too hard to count, too hard to act on. Nonsense. Thanks, guys.
Thank you, Dr. Nick. I do understand how difficult it would be to really promote a low carbon healthcare. There are many factors such as technical capacity, reliable infrastructure, financing mechanism to shift towards a greener option. But it's good to hear from you that there are already highlighted co-benefits for investing on low carbon healthcare. And thank you again for sharing your forward-looking insights. Okay, and now to our last presentation for today, and to bring us a country lens, we welcome Dr. Chancellee Pomavong. He is the Deputy Director General from the Department of Planning and Finance, Ministry of Health and Lao PDR. He will be sharing experiences in transitioning towards green procurement. Dr. Pamavong is a highly experienced public health professional with over 2 decades of expertise in health systems, strengthening health financing, and digital health strategies. Currently, he is serving as the Deputy Director for the Ministry of Health, and he has played a pivotal role in implementing national health information systems, developing health financing policies, and leading health sector reforms. Throughout his career, he has led significant initiatives, including result-based financing frameworks, the implementation of health equity funds, and the creation of national digital health strategy between 2023 to 2027. The floor is yours, Dr. Pomavong.
Thank you for introduction, very interesting to hear from different speaker from the opening by Karin, Kumar from UNDOP, and Philip, ADB, and also the last speaker. Very interesting that procurement is not just only what we want to procure, and what I understand that the linking between procurement and climate and also other environment and other things is very obvious. But also procurement also linking to the social, like gender. Very interesting to hear from that thing. Next slide, please. Next slide. So this one I don't want to repeat again because many people already talking about that the health. In the health sector, we have produced a lot of plastic, hazardous, and also the waste from the service of the health service. Especially, we know that during the COVID-19, we produced a lot of the waste, medical waste, to the damage to the environment, and we also know that we use a lot of energy and water in the health sector. We know that procurement is also a driver for waste and emission. And we just learned that the Green Public Procurement Action Plan that's existing since 2022-2025. But we also need to learn more about it. Next slide, please. So we know that yes, we have some country initiative for get rid of the opportunity for green procurement, a number of policy that we have and framework that we have, and the following slide a bit more detail on the enabling policy. So we have the public procurement law and regulation supported by the ADB, the Green Public Procurement Action Plan that we just heard about it, and also the implementation rule and procurement guideline already in use. So also the country has commitment on investment in the quality of healthcare and resilient health service, green primary healthcare initiative to promote eco-friendly facility, which is funded by the ADB. Also commitment to SDG, because SDG 3 on health and SDG 12 on responsible for consumption and production. Also, we have in the country a lot of different partner in health sector, including also ADB, World Bank, WHO, UNICEF, UNFPA, GS, other partner that also find it tight and also policy to be in line with this procurement, green procurement. Next slide, please. So we know that the challenging on transition to procurement, I just mentioned that we know only procurement, we know how to purchase, what we to purchase, but we don't know what's the impact of this procurement. Very interesting to hear from this speaker. So we know that we have limited supply and eco-friendly medical good in local market. We even though in our country we also don't know what is the local market that can produce good eco-friendly medical good. We don't know yet. Also, we know that if we want to move to the green procurement, we need a lot of investment, and also we have limited technical skill or to prepare. For example, we're talking about the procurement, what we need to prepare, how we prepare so that we don't create more impact to environment. We also have weak monitoring and reporting system for the green procurement, public procurement in health sector in overall, especially in Ministry of Health. Also, national procurement company existing in our ministry a long time ago, but we didn't know only how to procurement, and also have different located in different department. For our department, for example, in our department, we're responsible for the procurement of the construction, which is very important responsibility. And other department like food and drug, they are more responsible for procurement of medical drug, mainly drug. Healthcare department responsible for procurement of the which we call medical equipment and other thing. And also we know that we have we request that different department, different partner to submit our annual procurement plan, but we get only from, we know only from what been purchased using the government budget, but other procurement, big procurement from partner, we don't know. Sometimes they already finished construction, they don't have any environmental safeguard. We also don't know yet. Also, delay of the procurement of medicine. This is part of the whole process of the current procurement process that we have 4 different committee. We use mainly just a paper system. Next slide, please. So as I mentioned that we have, for example, we have Ministry of Health don't have yet the standard green procurement, because I just heard about green procurement policy. It is this activity participant at the national effort, national green public procurement action plan. Ministry of Health also have applied the centralized procurement system and follow procurement and management and guideline, because we have also Ministry of Finance also produced procurement guideline. We also have under Ministry of Health also based on that, we also produce different guideline from government, also from different partner project that already have experience on this. So we also have the balloon partner to support, like ADB, which you know that we have under ADB project, we have the 3 project under here, the Green Primary Care project. Like we have to, before, I know that before we construction anything, we need to also consider the impact for the environment, so that we can prevent this happen to impact to the any procurement on the equipment, medicine for the project. We also consider on this under the ADB project. We also have WHO, who are always strengthening the climate, who are responsible for the climate resilience of the Lapedia, because under this WHO, they got the funding for the climate change implementation. So they also including procurement of different construction and also some of the medical equipment. So they also they has also the consider accounting for this impact of the procurement. We also have in the country, we also have UNDP, like example here, like a Mitrapap Hospital rehabilitation. So they just starting that they will consider the impact of the renovation of the hospital that built long time ago by the Soviet Union. So now we have to renovate to include all the environment and safeguard. And we also have the GIZ, World Bank, ADB, World Bank also. So that we have this, how we can make this, so next slide. So current action, what we have to do. So we need to pilot this initiative, because we know that green procurement is the thing that we need to implement. So we need to update and technical specification for equipment and medical supply. If we purchase some medical equipment, other thing we need to consider that technical specification that take into account the procurement, green procurement. We also introduced of the green criteria, like energy efficiency, waste reduction in selected tender, like a medical equipment, as I mentioned. Staff also need to be trained on sustainable procurement practice, and also collaboration with WHO, UNDP, and other partners, so that we can have to build more capacity on how we can have develop a policy and alcohol labeling and promoting sustainable practice in the public and private sector. Next slide, please. So this the one that we have considered under the ADB project and other partners. So we have currently we try to introduce which we call e-procurement system, so that we can reduce the number of paper system that we have used to do. So if we move to e-procurement, many things will be in line with this green procurement. And long time ago, we also apply the open source health data collection using the SSO system. So we also contribute to reduce the use of paper system. And we are trying to link our interoperability with different systems that we have, like a DSS2, M-Supply, or electronic medical record, because instead of we have different logbook in the health facility, logbook for the different program. So now we are moving to the electronic, so that we can reduce the health facility using the different paper system. I know that before we introduced the DSSO system, the electronic, we have to purchase a lot of logbook to all health facility and use a lot of paper. Next slide, please. So we are now already starting the e-procurement. We have a pilot in some of the province, and we have reflection from different province and district that this is the good thing to do, because it's easy and also less time consuming and transparency. And many people interested that if we have this all kind of e-procurement, not only for the medical equipment, and also for other things like procurement of the construction, procurement of the good, other thing. If we move into e-procurement, will be very good. So the minister are also thinking about how we can link with the M-Supply system, so that when we already procure the especially medical equipment, how this drug or equipment can lead the faraway health facility, so that we can contribute to this green procurement. Next slide. Yes, so the way forward, we are going to scale up this pilot energy efficiency equipment like e-procurement, and how to link between different electronic system that we have, so that we can reduce the usage of paper. We will develop, we have a green procurement checklist for all tenders, so that we can have ready document when we procure whatever the medical equipment or drug or other construction work under different project, not only ADB project, but also other project. We have this green procurement checklist for them, so that they can consider accounting for this green procurement. We also need to strengthening the supply and engagement and training. That we need to training people, not only the health sector staff, but also our supplier. We also need to monitor the KPI, waste reduction, percentage of tender with clean criteria and energy safe, and reporting. We also need to strengthening the partnership technical agency, like different partner who are working in the health sector. So I think this is the end of my presentation. Thank you.
Thank you, Dr. Pumavong. Those are really valuable lessons from Lao PDR, strengthening green procurement, starting from policy to embedding into your system and actually building the capacity of those who will be um, in the core of green procurement. So those are really valuable lessons. Thank you very much again, Dr. Pumavong. And now, to hear reflections from the earlier discussions, we are privileged to have with us Dr. Eduardo Banson. He's the Director of Human and Social Development of Asian Development Bank. He champions the universal health coverage and has long provided technical support to countries in Asia and the Pacific in the pursuit of this goal. Before joining ADB in 2014, he was the President and CEO of the Philippine Health Insurance Corporation, World Health Organization Regional Advisor for Health Financing for the Eastern Mediterranean region, and WHO Health Economist in Bangladesh, the World Bank Senior Health Specialist for East Asia and the Pacific region. The floor is yours, Director Banson.
Ah, Thanks a lot. Okay. So first of all, thank you for all the presenters in your presentation. And it's quite interesting, of course, that we're on how on as we talk about sustainable. So in a sense, what we need to pursue is how can we get countries pursue, implement green and sustainable procurement. The terminology itself, of course, is quite lots of definitions coming out of what is green and sustainable. End of the day, it's essentially, for me, the way I understand it, that we procure not just because we want a particular good, right? We actually say we want to make sure that that we are leveraging the money that we are using, whether it's loan money now from ADB and then the government, of course, spending it. You're leveraging your purchasing power to make sure that certain objectives, so when we talk about sustainable procurement, social objectives, right, in particular, green procurement, something that will, of course, lessen the adverse impact on the environment or reduce climate change would happen. Very similar to all the health people in this call on how we have been talking about strategic purchasing when we talk about, or using the government money when we buy health services. So moving forward, what really gets me is the presentation of my dear friend from Lao PDR. He talks about the need for electronic procurement because at the end of the day, unless you have the information ready to you, readily available of what you are procuring and all, you will have problems leveraging your money. The more that Lao proceeds to electronic procurement, e-procurement, the more that in their better position to demand to include in their specs green components, or to include in their specs, let's say, compliance with labor, compliance with gender and all that. Without that information readily available to them, that means in the current setting that they have, or they used to have, which is all paper and pen, it would be hard for them, even if they include this. So I think that's the first thing we need to talk about. To move forward, we really need to shift and help all of the health ministries of health shift to more electronic procurement, make the data available. We move away from pen and paper. The second is that when we talk about green procurement and all of this, that means you write down your TORs in a manner that captures the green elements or the sustainable elements. This should not be the job of development banks. This should not be the job of the UN. This should be a capacity that should be empowered with the governments. So whether they start talking that all their conditionals should be inverted, that means they should know how to write the TORs, the specifications, the RFPs, that this captures them. And I think this is something that's missing right now in lots of countries. We don't have, I have noticed that we don't have biomedical engineers in ministries of health. We don't have hospital architects. And in the absence of this capacity, governments end up just, well, cutting in pace what used to be there. So if to proceed to more sustainable and green procurement, it's not just the procurement process itself, in making sure the government would be able, because that's where procurement starts. The third is that we also need to make sure, and that is a point Chancellor said so well, What if nobody will sell? So what if nobody will sell you the inverter air conditioning that you want? What if nobody will sell you the medicines that's manufactured in compliance with sustainable requirements? So you need to understand your market, and you need to incentivize that there will be people who sell. Now, to imagine that this can be purely incentivized by government money, leveraging government procurement, maybe, but we know it's not enough. You need to really incentivize the supply side, the suppliers, that they'll be able to do this. And I think that's the missing point. We do tend to think that just having procurement policy is enough to make the market response. If it does, great, wonderful. I'd be the happiest person in the world, but maybe we should go beyond that. And this is where we need, and the ADB, we're looking now, studying supply chains, manufacturing, all that. Because if we want really for this to happen, then you need that to happen. And lastly, I really would love more presentation when it is governments doing the presentation. And governments are doing this not because they're driven by ADB loans or required by ADB loans or some other UN agency. Because for me, at the end of the day, Nick is here. It is when Singapore as a government, or the UK as a government, decided to do it on their own. And that led to the changes. Nick said it so well. This is not rocket science. This is not difficult to do. So governments should commit to this. So governments should not see this as ADB conditionality or loan requirement or something like that. This should be seen as something that government wants to do themselves. So these are among the points that I hope can help us look into green and sustainable procurement, that it becomes more than a checklist requirement, but actually something that will be owned and championed and capacity built, not just in this itself, but really in the whole procurement process and supply chain. Because unless you have strong ones, then you could never make this work in a sustained manner. I'll stop there. Thank you.
Thank you, Director Banson. We couldn't agree more. And thank you for tying together the policy and the investment perspective, and also highlighting the bigger role of the government in championing and owning green procurement within their respective countries. At this point, and for the interest of time, we don't have more individual time to call for your questions, but we do see your questions on the chat box, which were already addressed by some of our speakers. So at this point, we will just receive your questions via email. If you would like to give time to think about the questions that you're trying to yield from this webinar. We will give you the link to questions and also the link to this webinar if you still have a lot of questions. And now we move on to our closing. And before we close, may I invite Dr. Alexa Esperato, the Senior Health Specialist of Asian Development Bank, for the closing remark. Dr. Esperato is a Senior Health Specialist in the ADB. He previously worked on health systems in Latin America, the Middle East, and India with Gates Foundation, World Bank, and World Health Organization. Alexo obtained his PhD in health services in Johns Hopkins University and having trained in economics and public policy. Dr. Alexo?
Yes, thank you, Mylene. So I would like to express my deepest gratitude to the outstanding speakers and, of course, to every one of the participants for joining today's event. In this session, Mr. Sentil from UNOPS has explained how the sustainable procurement core principles at UNOPS, as well as the green procurement framework, which includes health, climate change, and gender. An essential component of this framework is the UNOPS climate-friendly procurement strategy, which includes specific targets, which include, amongst others, the requirement of emission reduction plans from suppliers, from all of its suppliers in the future. He also shared the UNOPS Drive program, as well as the Possibilities Forum, both of which promote sustainable procurement and provide examples on how these principles apply at the country level. Philip Kalpaxis from the ADB emphasized that procurement is a leverage for sustainability, and he discussed how sustainability criteria are built into ADB procurement processes, as well as the importance for both ADB and member countries to have policies, guidelines, processes, and market-shaping activities on green procurement. ADB is supporting this through knowledge sharing and technical assistance activities. ADB is also supporting countries to embed sustainability criteria across the entire procurement cycle as to attain bio-circular economies. And he reflected on the challenges to attaining green procurement as well as their potential solutions, particularly at the regional level. Dr. Nick Watts mentioned that the health sector is, or he discussed that the health sector is a big consumer and thus generator of CO2 emissions. As well as the importance of addressing these emissions, not just at scope 1 and 2, but also at scope 3. This requires 3 sets of strategies that are mostly low tech. The first one is focusing or improving manufacturing, transport, and packaging processes. The second one is efficient clinical practices, particularly reducing healthcare waste, which in some health systems, such as the US, can be up to 30%. As well as sustainable procurement. Dr. Chansa Lee's presentation focused at the country level. He discussed the laws and strategies and projects in place at the Lao PDR. One example, for example, is the National Green Procurement Action Plan from the Lao PDR. He also discussed the challenges in transitioning to green procurement in low and middle income countries, which include higher procurement costs, limited availability of eco-friendly products, and limited awareness and capacity on green procurement member countries. He discussed some initiatives such as the Green Primary Care Project, which is supported by ADB, but also other projects that are supported by the GIZ, the World Bank, and the WHO. So there's plenty of development partners supporting that. These various strategies are supporting actions such as the inclusion of green requirements in procurement tenders and their tracking through KPIs, in the development of the capacity on the workforce on procurement. He also discussed the importance of digital systems, particularly e-procurement and logistics management information systems, as to reduce medical waste, track sustainable procurement, and reduce paper trails. The pathway to a net zero health system is a marathon. Ultimately, the goal is to attain a sustainable procurement culture through the inclusion of sustainable criteria across each step in the procurement processes. Sorry. Strategies beyond that, as discussed by Dr. Watts, include improving manufacturing, transport, and packaging, and reducing healthcare waste, right? So it's not just procurement, it's also related strategies. These require essentially a concerted effort amongst all stakeholders, including the private sector suppliers, which need to be adequately incentivized, as Dr. Van Zont has discussed. These interventions can be aided, as discussed by Dr. Chansa Lee, by technologies such as e-procurement systems, as well as lower-hanging interventions such as the reduction of single-use products. It's also important to expand the capacity in green procurement and also in related areas, as convened by Dr. Van Zont, such as biomedical engineering and green architecture capacity. So thank you all for your time, for your passion, and your commitment to this critical work. And we're looking forward to working with all of you, with our member countries, on green procurement in the future. Thank you. Over to you, Mylene.
Thank you, Dr. Alexo. So for the recording and materials from this webinar, this will be uploaded later in the secure web page. And that concludes our session. We hope the discussions have sparked ideas and collaboration to advance green procurement in Southeast Asia's health system. On behalf of ADB and Secure Team, thank you, and we look forward to seeing you in future webinars. Thank you.
Thank you.
Thank you.
Thank you.
Thank you so much.
Thank you so much.